Community health workers in Iowa, an urban and rural perspective. An urban perspective, Black Hawk County Public Health in Waterloo, Iowa. What value do community health workers, CHWs, bring to urban communities?
My name is Caitlin Emmerich. I'm the Public Health Director for Black Hawk County Public Health in Waterloo, Iowa. Black Hawk County is a population of about 130,000 people. We're considered an urban county in the state of Iowa, but we also have areas of our county that are rural as well. We are probably one of the most diverse counties in Iowa in terms of per capita. We have a long history of having a refugee and immigrant population, of having a lot of different diverse perspectives in our community, which makes us a wonderful, exciting, vibrant community, but also presents some unique challenges and opportunities for us to address. Someone might assume that in an urban type area that everything is accessible. Well, even in urban areas, things are not necessarily accessible. We still have transportation barriers. We still have barriers with getting access to services because there might be so many services in the community that you don't know where to start or you don't know which ones exist. So definitely the similar kinds of barriers that are experienced in rural areas are also experienced in more urban areas. They might look a little bit different, but the barriers still exist. And I think that community health workers have a very unique and important role in making sure that even if a resource is just down the street, that everyone that they serve has the opportunity to access that resource.
What makes community health workers effective?
Community health workers are really effective solutions for public health problems. The community health workers are a proven model and a cost-effective model for improving health outcomes within communities. So because community health workers are trusted messengers within the community, they're really able and best suited to help clients and community members navigate their health needs and specifically address things like health literacy. Through their teaching and culturally competent ways, they're really able to serve clients in a variety of ways. From an employer's perspective, having employees that have a variety of lived experiences really adds value to the workforce. And community health workers intrinsically are diverse because they're bringing their lived experiences with them. And so that really makes not only what they bring to the community beneficial, but what they bring to our organization as coworkers beneficial.
The voice of community health workers. What inspired you to become a community health worker?
My name is Leticia Chabot. I am a community health worker for Black Hawk County Public Health. I am a community health worker because I went through the same situation that the clients that I have are going through. My role is basically I am a bridge to the Latino community. Most of my clients actually need resources that we actually have in the community, but they don't know of. And I steer them to those resources.
Hello, my name is Florina Zibok. I'm a community health worker here at Black Hawk County Public Health. Before I became a community health worker at the Black Hawk County Public Health, I used to help a lot of people from my community. People reach out to me with the stuff that, as I become a community health worker, is now doing, with the applications or taking them to the hospitals because of the language barrier. Try to interpret it for them, translating the papers that they don't understand, reading it to them. And a lot of people in my community reach out to me if they need help with the stuff that they need.
I am Julie Molisho, a community health worker for the Black Hawk County Public Health. It's been 4 years since I'm in this position. I help with the Congolese and also the French-speaking community around the Black Hawk County Public Health. I feel like a community health worker job, it's first a calling, a passion. It's not like a regular job that anybody can do. It's something that someone has to be passionate about it. When I started working here, I was already doing these things, but I didn't know that that's what they call community health worker. I came to America in 2010 and I didn't speak no English. I didn't know anything about American system myself. So I struggled a lot. And I was like, the best way I can help myself is to share this knowledge with others, to support others so they don't struggle like I did. I think that's what motivated me to help people. And yeah, that's how I found myself in that position.
As a community health worker, what value do you bring to the people you serve?
The most valuable aspect is that we are the bridge for those in need. If we were not here, people will not know where to go. It's okay, we have a community and other people will say, yeah, you can do this, but they don't even know how to start. And that's what we are here for, to start them having a better life, having a better health, and that's what we do.
Having a community health worker is invaluable because they provide support that's tailored to our unique needs and culture, helping navigate the healthcare system that takes change in our health. I've helped numerous families in my community with Medicaid SNAP application, connecting them with vital resources and support. I let them know about the other resources that I can give them. And if there's any other way of organization that I can let them to, I can refer them to any other resources that they can connect with.
Community health worker doesn't happen in the office only. It's happening outside of the office. Public health is where you are. So we have to go to the community. They trust us and they give us the ground, the room to help as much as we can. Someone can come for one need and it's going to turn to 10 needs. I want people to know that if you are pregnant, you can go to WIC and they can give you information. I want people to know if you are struggling with like maybe bills or something, you can go to Operation Threshold. This is my first goal, resource awareness.
What barriers or challenges do you see in your community?
The barriers are language. It's almost 90%. That is the barrier, is language. People don't know of any resources, again, because they're new to the area. Some people are not new to the area and still don't know half of our resources. So what we're trying to do is make them aware of those resources.
And we're struggling because we have resources, but the requirements doesn't have eyes or hearts to feel or to see what is going on.
The challenges motivate me to work harder for the people in need and trying to be there when somebody is in need.
As a community health worker, how do you build trust within the community you serve?
If it's no trust, it's going to be hard to help somebody. So what I do, I try for them to trust me. I tell them some of my own life experiences and they understand that I went through the same thing. So they understand and they trust me more because of that. I put myself with them because I went through it. So it's not hard for me to understand of what a person's going through when you go through the same thing. So the reason that I help so many people is that I just want to help as many people as I can. It doesn't matter what. It doesn't matter what type of resource. It doesn't matter what it is. It can be clothing. It can be anything. And I can assist with anything that they need.
How does culture influence the way community health workers serve their communities?
Culture play a huge part in the work that I'm doing. This American healthcare concept is really different from what we have back home, but it's not only the healthcare that is different, it's also the tradition, the culture, the language, and all these little parts play a huge role in a way that you can rent a service like a health service to someone.
Most of the people that come in from other countries think the ER is like a clinic. And we actually tell them, look, we have other clinics that you can go. It will be cheaper than the ER. So it's easier that way for your children.
I went to visit a lady one day. She just had a baby like 4 months ago. And I was asking her how the breastfeeding go. And she's like, no, I stopped breastfeeding. And I was like, why? She's like, my baby don't want to latch no more. I was like, did you try the pumping? And she was like, what pumping? I was like, if your baby can latch, you can use the pump to, to take the milk and put like in a bottle and give the baby. She's like, I don't know about it. And why the lady don't know about it? First, she had more money, so she could not qualify for the service that could help her. But second, I think a language barrier. I'm sure someone talked about it, but she didn't understand what that means. Second thing, it's cultural differences. We don't have it back home. You guys have it here. How this look like? How do you use it? Also, this come back to the same things, advocating to have community health worker everywhere. Because the community health worker is not only giving the information, but they're giving it in a culturally relevant way so that person can understand what they're talking about. That lady didn't get information in a way that she understood and be able to take action. So there is the gap between the services, resources, and the people that can only be filled by the community health worker.
How do community health workers help address misinformation and share accurate information?
A lot of misinformation is happening in public health today, and our community health workers have really played a vital role in identifying that misinformation and getting correct information out there to our community members.
When we had COVID, back home, people don't want vaccine for several reasons. A lot of things happened. But they need someone from the community who knows the language, who knows the reality, to go over this vaccine, the importance of getting vaccinated with them, for them to understand. If another person come, they be like, that person want to, to harm us. But if someone they know, they trust, it's a little bit easier. And also when I explain to them, I'm not just explaining the concept, I'm also breaking it down in the level of understanding, and I'm using their own language. So this makes things a little bit easier for them.
How do community health workers strengthen communities?
Something that I've learned in the last couple of years while I've worked more and more with our community health workers and their supervisors and their managers is that the work that they do has an exponentially positive effect on the community. So I think that every community can benefit from a community health worker, and probably most organizations can benefit from a community health worker, whether it's called a community health worker or whether it's called a navigator or whatever it's called. Somebody that is helping our community navigate to services in very complex systems, that is beneficial for everyone.
Having a community health worker, it's having the connection to the community. When it comes to health, we are all together and we need to try to help each other. And community health workers are the best ways for organizations like public health, like hospital, to reach especially to the community we're serving.
One thing that was unexpected for me was the impact that our community health workers have on partner organizations and the benefit that they bring across the system of public health. So even if an organization doesn't have the resources for their own community health worker, that community health worker, just because they're employed by a certain organization, works for the entire community and benefits the entire community.
What positive changes are you seeing with the population you're working with?
The change I'm seeing is people start understanding, let's talk about public health program and services. They start understanding it and also they start requesting it. This is like a big win for me because like I said, when people come here, the health system is different. So what I'm doing is first educating them. I feel like the education part is going well, and I'm happy that some people start requesting our service.
The Community Garden, an example of how a CHW has positively impacted their community.
My name is Eileen Musengele. I'm a community health worker. I work for the River Arc, that is an NGO for Congolese. We work with Congolese immigrants and refugees. I'm from Congo too. And I'm also a CNA, and I'm an island gardener. I have a garden to Island Park. I have been in the community here, I can say about 6 years. The benefit of having a garden is that it gives us healthy food for our family. It helps us to be together in our community, and it helps us to know other cultures, because when we go there, it's not only Congolese. We go there and we find other people, and we know their culture too. And it helps us to share with those who don't go there. They have healthy food, the food from our country that we don't have here. Coming to the garden helps us to come with our family. We come with our children. They help us to water the garden. It's a good exercise for them. They can help us, and we have a healthy activity for them, a sane activity for them, instead of staying home on the computer or on the phone. They can come and have another activity. That's good.
What would be helpful in strengthening the community health worker workforce?
Right now, there is not a third-party reimbursement model for community health workers in Iowa. That does exist in other states, but not in Iowa. So right now, our community health workers are funded through braided or blended funding of a couple different varieties, whether that's grant funding, whether that's local tax support, private foundation funding, things like that. So one of the things that would really help in facilitating community health workers in organizations, in communities, would be establishing a third-party reimbursement model in Iowa.
We need more awareness that they are community health workers out there that can help you. I think in the workforce, it should be a training for community health worker, and it should be like classes for people to become community health workers. That will be very helpful for the community.
What do you love about being a community health worker?
The people. I love the people. I know it's hard, especially in my position, it's hard. But like I said, community health worker is not like a regular job. It's a calling, it's something that requires passion, that requires empathy, compassion. So yes, the people.
I love being a community health worker. I do feel that I have impact with my community.
I think I'm very resilient. I love what I do, and it doesn't matter what. If I have a job or not, I will keep doing this for the rest of my life.
A Rural Perspective, Guttenberg Municipal Hospital Family Resource Center in Guttenberg, Iowa. What value do community health workers bring to rural communities?
I'm Dr. Jeff Hoffman. I'm a physician from Guttenberg, Iowa. I've been here since 1991. Guttenberg's on the banks of the Mississippi River in northeast Iowa. It's a very rural area. The town is only about 1,800 people. The county is less than 18,000 people. We don't even have a stoplight here. So often when I see patients and they have needs that can't be met far away, we have to do it here. And quite often when I see a patient in the clinic, I can take care of their medical issues, but I cannot take care of a lot of their social or financial issues. It's hard for a patient to get a medication when they're worried about their next meal or where their heating's coming from or if they're being abused or have some other issues. And I learned that when I first got here in 1991. At that time, we really didn't have any mechanism to help them. Over the last 26, 27 years, we developed what's called the Community Resource Center. This is a center where we have a community health worker, and what we do is contact her if there's issues that I can't handle or our clinicians cannot handle in the clinic.
My name is Carrie Harbaugh. I work for the Guttenberg Municipal Hospital Family Resource Center. I serve as the Family Resource Center coordinator and also a community healthcare worker. The Family Resource Center is a department of the hospital, but it serves as a community hub for other agencies that serve our area, Clayton County and the surrounding area, for clients to meet with agencies or resources to meet their needs. Some of those would include food pantry, we have a clothes closet, durable medical equipment like wheelchairs and shower chairs, walkers. Our county doesn't have any agency that provides those, and we do have 2 hospitals in our county. Some of the agencies that would work out of here would be vocational rehabilitation services for disabled population, legal aid, emergency management, helping services with domestic and sexual advocacy, Riverview Center, among several others. The collaboration and partnership that we have with these agencies is invaluable. Just building that trust among them allows us to build the trust with the communities that we serve.
If we didn't have our community health workers here, this center would be nothing. It's only a building. But the community health worker, they unite all the different aspects of the community and all the different problems that we have. And they take the problems and they turn and find solutions.
Why are community health workers important?
All of us can listen to a client and see what their needs are, but if they don't trust us, we're not going to go anywhere. And I think the benefit that we have here in Guttenberg with our community health workers is that they are local, that they are trustworthy, that they're honest, and more importantly, they're very good listeners and they are non-judgmental. And that keeps the client very at ease, and therefore we're able to help them and hopefully prevent further trauma in their lives.
As a community health worker in our community, I'm a trusted community member that anyone can come to for any reason that they want to address any social determinants they may have. They may want to know how to access different resources and they're not sure what those resources are, or they just want to call and talk through a problem and see if I can identify any place that they might be able to turn. That can happen anytime they want, and it doesn't cost money. There's no charge. You don't have to be in a certain insurance. That's just kind of what our hub is about. It's about just a place to turn, a connection, a local, centralized place that all resources can be accessed.
Community health workers have definitely helped us lessen some of the burden that's on our staff. Before we had those, my nurse would see a patient and they would say that patient X is having difficulty finding food or they don't know where their next meal's coming from. Well, we had no idea how to help them. Now that we have the Community Resource Center and we have a community health worker, we're able to call them and they can help us right away.
How do community health workers support patients and staff in healthcare settings?
They're involved directly with us in the hospital. They are part of our staff. They are as important to us as our physicians, our nurses, our social workers, and everyone in there. Because often these community health workers will know this patient or this client better than we do. And they'll know some social determinants of health that we don't know or don't realize, and they'll let us know that in advance. And that often does help us. Community health workers have definitely helped us help patients adhere to their treatment program. I can give a medication or I can prescribe physical therapy, occupational therapy, or whatever it is to help that patient. But if they don't have transportation, how are they going to get there? If they don't have any way to pick up their medication, how are they going to get to the pharmacy? We call the community health worker.
How do community health workers bridge the gap between healthcare and the community?
How community health workers bridge the gap is we are in the community. We are the ones networking, building the relationships with the families and the schools, the churches, the grassroots organizations that make up our neighborhoods. I live in the community. I live in Clayton County here in Guttenberg. So just being relatable and working with the families outside of our hospital setting allows them to feel more comfortable and at ease. It's a safe environment with no judgment and really just to help them access the resources that they need. A typical day for me, there's really not a typical day. It could start out with a referral from the hospital and I have to go over there and try to help address some needs for a patient and their family. Or it could be starting out here with the police coming in and needing help with a transient or homeless, identifying services for a family that had a fire. There's really not a typical day, which is hard for creating flow charts for people when you're not there. But I think the biggest thing that we can do and that our job is we're responsible to know what all the resources are for our area.
What personal qualities and skills are essential for community health workers?
To be a community health worker, you have to genuinely be passionate about this. You have to genuinely care about people. You have to have a lot of empathy, non-judgment. You have to just kind of leave all of that behind you and really focus on genuinely caring about the person that's in front of you or that you're working with. The passion gets fueled by seeing the success stories. We get overwhelmed with like gratitude and people are so grateful, but really it is like this team of people. Everything from the volunteers that stock the shelves on our food to the agencies that come in and help them with legal help or help them with mental health and brain health. So it's this team that we create. So that really makes me very passionate about it. Is we can't do it alone. It's a partnership, and without that partnership and network, it doesn't work as well.
How do community health workers collaborate with community partners?
The community really buys into this and they really feel a part of it. So any successes we have really are theirs. Starting out, I had to kind of learn the resources. I didn't know what the networks were. I didn't know what was even available here. I always say to our clients when they are apologizing, like, oh, I don't know. Why would you know? We don't know until something is upon us that we need to figure out, what is the resource for this? So by building those connections and like really vesting in them and learning more about each of the agencies and trying to see what I could do for them allowed me to build like trust. And it allowed me to build like that foundation that's really important for when you have a crisis or you need to lean on them. Hey, I have this scenario, I need your help. It's more of a friendship almost.
Why is the work of a community health worker meaningful and fulfilling?
It is so rewarding just to be a part of people's story, just to see that what they can do and believe in them and connect with them. But honestly, it's just so much bigger than us. It's all of the network. It's the hospital, the volunteers, the agencies, that it doesn't work with one of us alone.
What makes community health workers a valuable investment?
The funding for the community health worker is pretty minimal to our hospital's budget. The benefits are huge. Because of the amount of impact and all the things that we really get credit for, the food pantry, all the networking, the deliveries, the crisis supplies, the back to school bags, the Christmas, the list is endless, really, what we are able to do through here. All of that money is really through community. We do write for some grants, and based on our numbers, there are some local grants we get, there's some larger grants that sometimes we get, but it's really the community that supports it.
I would advocate that we speak with our representatives, both locally and nationally, to see if we can get funding to start programs like this. I think if there was a funding source, more communities would do that, and it would be very successful because we handle our problems here locally, and that's what we want to do because we know our people, and the community healthcare worker is very integral in that part. As I said earlier, she is the spear that leads our team. She's the one that is able to relate to the patients so that we can better treat them and help our community. I would say to all providers, if they see this video, that if you don't have a community health worker, please ask your administrator or ask your staff to see if they can get one. It has really helped lessen some of the burden that we've had here at Guttenberg and has helped our patient care as a whole. We are a medical home here at Guttenberg Municipal Hospital and Cornerstone Family Practice, and we totally embrace that concept. And the community health worker has helped us actually solidify that. They're the glue that holds everything else together for us.